All right. Hello, everyone. Good afternoon, good morning, good evening, whenever you're watching this. It's May 29th, 2020. My name is Laura Catania, and I am Ayuda's Volunteer and Community Outreach Coordinator. I am here today joined by Carla Nájera and Andrea Wind, and we are here to discuss mental health and Ayuda's mental health services for our client community. Carla and Andrea are two of our social services staff members. And so I want to start off this chat today for May, which is Mental Health Awareness Month, introducing Carla and Andrea and letting them talk just briefly about what they do at Ayuda. So let's start with Andrea. Andrea, can you introduce yourself and tell us your position and how long you've been in Ayuda, where you work, which office that being?
Sure. Well, hello, everyone. My name is Andrea Wine. I am currently the Director of Social Services, and I am based out of our Tacoma Park office, but I work out of all three of our client-serving offices in Falls Church, Silver Spring, and Tacoma. I've been with Ayuda for about 3.5 years. I actually started as our therapist and was in that position for a little over 2.5 years. And now as the director overseeing our therapists, our case managers, our client assistant needs programs in all three offices.
And my name is Carla Nájera. I'm the therapist at Ayuda, and I've been here for about 3 months now. It has been awesome being new, but getting to know everyone. And I am based out of the Silver Spring office in Maryland.
Awesome, thank you. I'm Carla, I think I said your name wrong, so sorry about that, but thank you for pronouncing it correctly.
Well,
and
you got it. It's Nájera or Nájera, either one.
Oh, okay,
Yeah.
Wonderful. Yeah, well, we're really excited to have Carla join us at Ayuda. So thank you both for those introductions. And first, I guess I just want to talk about social services for a minute. I think some people watching this will be familiar with our social services program and others might not be. So what is our social services program at Ayuda, and what do we do to help clients in social services?
Sure. Well, as I briefly had mentioned before, social services offers wraparound services for kind of meeting our clients' needs, whether that be basic living needs, mental health needs. So we offer case management, therapy, client assistance programs such as a food pantry and a diaper bank, as well as support groups. And we serve immigrant survivors of trauma, and many of our clients are survivors of domestic violence, sexual assault, and human trafficking, but we do serve others as well. Those are some of our main traumas that we do see. And with our case management, we really are working to kind of provide the clients with their basic needs, or meeting their basic needs. So helping them finding housing, getting public benefits, making sure their kiddos are in school, if they need help with medical services, etc. And with our therapy, we really work with our clients who have experienced multiple types of hardships and trauma to understand how resilient they are, but to also process the traumas that they have experienced so they are no longer affecting them in such an impactful way in their day-to-day life, so they can move on to live fruitful and resilient lives.
And it's true that at Ayuda, our legal and our social services program works very closely together, right?
Absolutely, yes. It's actually really wonderful, I think, to have both our legal services and social services housed together. One thing that we know is that it can be challenging for our clients, not just clients, but for all of us to kind of go, between point A, point B to get services. And one way that is effective and time efficient is to have our services housed together. And many times we get referrals for our social service clients from the legal team. We have walk-in clinics at, right now in our Tacoma Park office, where a staff member may meet with, or a potential client may meet with a paralegal, a lawyer, or case manager. So we do work to ensure that both their social service needs, and whether that be case management, mental health, and their legal needs can be met.
Yeah, that's so important, because I know a lot of our clients who are seeking legal services are also in a position to need extra social services, case management, mental health services. And one more question I had before going forward is how does somebody become a client of social services? What is our eligibility requirement?
Sure.
What kind of people do we serve?
Sure. So to be eligible, you must be foreign born. You must be under the poverty line, which I'm not exactly sure what that number is, but generally that's something that we try to work with our clients on. And you must have been a survivor of a trauma. So we're really trying to identify and assist clients who may not be eligible for other services, public benefit services, private in private practice when it comes to mental health, et cetera. So really trying to meet the gap of the people who are not being served by other assistance programs.
Right. And so beyond, can you just talk about therapy at Ayuda and what other type of mental health resources specifically that we can provide in social services? Because social services does so much. The case
Sure.
management program is incredible in that it meets so many of a client's needs and their family's needs. But specifically relating to mental health, how is it that we can work with trauma survivors through therapy and other means?
Sure. Well, I think the first thing to mention is that we, as a whole organization, are working to be trauma informed. And so what does that mean, really? It's shifting the approach of how you work with clients. So instead of saying, what's wrong with you, it is, well, what happened to you? So taking the blame off of our clients who very much feel guilty. So kind of shifting that, that lens from guilt to what happened. And so there are a variety of things of what makes something trauma informed. And really the first part is being grounded in trauma knowledge and education, and understanding that the impact of trauma is widespread. So you will see it in different ways in clients. It expresses itself differently. And it's important for us to recognize what those signs and symptoms are in individuals and families and communities, and making sure that we respond to our clients in a trauma-informed way where they are not being re-triggered, and in a way that is empowering them. So that again comes from every behavior and policy that we have set up is really informed by this trauma-informed approach. So we are able to provide a safe space. Safety is key to trauma work. And not only ensuring that they're physically safe in our building, but they're mentally safe, where they feel that they can collaborate with us, they can trust us. And I think, and I know actually that we do that in our mental health and our therapy services, as well as with our case management.
That's really important and really wonderful to hear. So thank you for talking more about that. And I was wondering, before I ask you guys some questions about what our services are looking like during COVID, because I think that's, there's been a lot of changes to our program and how that has worked, but I was wondering, how can you see a difference in a client's life after they've been able to sort of start processing, have a safe space to process their trauma with a trauma-informed therapist and with a culturally sensitive organization? Like, what kind of improvements do you see in a client's life after they have had access to therapy or other mental health resources that Ayuda can connect them to?
Well, thankfully, there are many ways that we've seen clients successfully move past their trauma with the assistance of therapy at Ayuda. Personally, I've seen in my work as a therapist is really, again, going back to that shift of self-blame versus understanding that bad things can happen to good people. And I think recognizing or seeing in a client when they recognize, you know what, this didn't happen to me because I'm a bad person. You know, a lot of times we get stuck in this mentality of, well, I must have deserved this. And that's something our clients say, we hear a lot at the beginning of therapy is, I'm a bad person. What did I do to cause this? And to see that shift from that self-blame to, you know what, I grew up in a pretty violent place where maybe we see a lot of women, um, maybe there is not the same respect for a woman's space, their presence, their agency, and all the pieces of that. So that, you know, it's not just in the family, it's in the community, it's in this, it's a systemic challenge. And so to see that is kind of like an aha moment. And it's really great to see our clients be able to kind of lift that trauma off of their backs and be able to set it aside and say, you know what, that is something that happened to us, or to me, and I wish it hadn't, but does not define who I am.
Right. And I'm sure that after working through that, that client is then able to more successfully overcome other challenges that they may be facing, or maybe able to apply themselves to whatever they're seeking to achieve in life, or relating to their family, and just it just has all sorts of ripple effects. So
Absolutely. I think one thing that we do a lot as therapists is to help clients identify their strengths, their internal strengths, their external supports. And when clients are able to see how they've used those internal and external protective factors and strengths to overcome something, it is easier for them to use it in the next challenge in their life. And so they feel more equipped to handle whatever the challenge may be that it presents to them.
that's awesome. And as we all know, there's a lot of stigma around mental health, and it can be especially difficult to navigate in a different country than where you were used to, and it's very confusing. So we're really grateful to have you and people like Carla at our organization who are working from this trauma informed perspective. It's really interesting to hear about that. So the next thing I want to talk about, I guess I want to pivot now a little bit to observations about your work during this time, during the COVID pandemic, how that may have influenced increasingly poor mental health in our client community. And as we've seen, I've been reading about this personally, people nationwide are reporting that they're experiencing a lot more anxiety and depression. A lot of people are getting on medication for the first time. So how is this situation of isolation unique to our clients?
So I can definitely speak to that. So I have like a unique perspective, but then I also understand this global perspective. So with the social isolation, like we know that being alone and feeling of loneliness can be a trigger and can lead to different, mental health conditions. But what I've found at Ayuda with these clients is that it's not so much the social isolation that they're feeling. These people are more scared of the actual disease because they're living in a home that has multiple families. So they may still have to go to work. They're not able to rely on really any system. So I think the challenge has been very different, hearing from different perspectives, but also just personally in this role, seeing our clients here at Ayuda. So that has been really interesting to see. And also, I think we've moved into this telehealth, platform, and that is very new to not only a lot of us providing the services, but also to our clients. They do not really know how to use a lot of this technology. And if they do, their internet may not be, adequate enough to connect them, and it may hang up. The other thing is that a lot of our clients are living with people that they do not want to talk about this specific trauma. So it's just a very unique perspective through this pandemic to see our clients. But again, going back to what Andrea said, they are very resilient. And so they are still pushing forward. They're still doing what they have to do, but they do have this underlying worry and fear, stress of the coronavirus.
Absolutely. And as we know from national statistics, the population that we serve is seeing higher rates of death from the virus and infection. So yeah, that's important to mention that they are facing an even greater fear. Andrea, do you want to share some thoughts on what it's like for our clients right now during COVID, during isolation?
Yeah, well, I think as we've alluded to, you know, the pandemic is a trauma. And so if we're looking at what a trauma is, it's an event and the after effects of the traumatic events, and that it can be physically or emotionally harmful and life-threatening, which I think both the pandemic in its illness in the physical form, as well as our self-quarantine, are both. They are physically and emotionally harmful, and they can have the second part of trauma is having lasting adverse effects on a person's functioning, which I think we are seeing individually in communities, as a country, and it impacts all the areas of our life. So our mental health, our physical health, our social health, our emotional health, our spiritual health are all being impacted by this trauma, this mass trauma. And what we have seen from other mass traumas like 9/11, Hurricane Katrina, research does show that there is an increase in mental health challenges and illness after the fact. So I think that's important to know that that's really what we're looking at here. I think for our clients, the uncertainty of the future is something that many of them have felt for a long time, especially if you are uncertain about your status, your legal status. Maybe you are without status, maybe you are in the process of getting status, which causes a good amount of anxiety and fear. And this in many ways is fuel to the fire, because we are now adding on a pandemic that has kind of upended our systems, our legal systems, our social systems. So I do think that the level of uncertainty our clients feel is even greater. And I do think that the pandemic, as we know, has been hitting immigrants much harder than others. For example, I think I read somewhere that said there's about 45 million immigrants in the states who live below 200% below the poverty line. And that's who our clients are. And if you're looking at that particular group, you know, I think Latinos are being hit harder economically by this pandemic. Black communities are contracting and dying from it at higher rates, and Asian communities are experiencing an increase in discrimination. So there is a lot going on in our immigrant communities that is not particularly being addressed. And so this is what our clients are coming to us with in the way their mental health is being expressed. I think also for our community, many of our clients have already experienced chronic traumas. And so and many of them which they have worked through and are living with, but to kind of put this pandemic on top of that it can be overwhelming, absolutely overwhelming.
Yeah, and I feel like if you've never heard someone tell you their story that has been through a lot already as a low-income immigrant in this country, you wouldn't be able to even imagine that the now added stress that people have. And I wanted to know if you know if a lot of our clients have lost work or if they're still having to go to work, because I know that with essential workers, it is a risk that you can bring it back to your family. And a lot of our clients live in a very expensive area where there has to be a lot of them in one apartment or one room because of the exorbitant prices for rent here. So what is that looking like right now with work that our clients are able to get or have still?
I mean, I can give an example with one of my clients. She lives in an apartment with 2 other families. She has 1 son, so it's 3 families living in this apartment, and she still had to go to work. She was working in the restaurant business, so they were considered essential, and she had to go. You know, she was the only provider for her and her son, and she contracted COVID. And so she had to wear a mask, and she was in the living room, and her son, who I believe is 8 years old, had to wear a mask at all times as well. They aren't able to really quarantine the way that we may be able to go to one part of our home. They are all kind of in this communal area and have to kind of do what they have to do to survive. And so a lot of also fears that come from that is not having insurance. And that's the other part too, you know, the financial burden of that. So yeah, it's been really hard for a lot of our clients, the uncertainty, and most of them are essential workers and don't have that opportunity to stay home and get support.
Right.
And I think just to add to that, as you were saying, Carla, you have people who have to go to work, and then you have families that live with other families. So you can have several families in an apartment, in a house. And there is the concern not only about the individual who's affected, but also knowing that I could affect others. And again, with the lack of insurance, what does that mean if I get it? I can't afford it, and then if someone else gets it, they can't afford it either. So there is an even greater fear of not only my own health, but but the well-being, the health, and finances of someone else.
Yeah, that also reminds me how just getting access to services or getting a application for a green card to go through is so empowering. Being able to overcome trauma or being able to work legally and know that you have support to offer yourself or your family in case of an emergency is something that we are trying to help our client population achieve. And it's been incredibly difficult, I think. It feels like steps backwards sometimes, but I know that our amazing donor population that raised a ton of money for our COVID relief fund has been able to offer a lot of extra support to our clients during this time who were out of work or who needed extra assistance with food and medicine and bills. And I know, Andrea, you've been spearheading all of that. So I was wondering if you could comment on that briefly.
Yeah, no, absolutely. Our donors have been amazing during this pandemic. And I think really it was wonderful to see, even from the beginning, before we all realized how dire the situation would be, the amount of interest and response we got from people in the community asking how they could help our clients, knowing that they would be very hard hit by the loss of their jobs, the lack of insurance, the lack of ability to pay rent and utilities. And so with our COVID-19 relief funds, we have been able to serve many clients throughout all three of our offices. And even if it's for a month of knowing, you know what, my rent will be paid this month, so I can focus on my child care, or I can focus on homeschooling my child. That really has been impactful. Or knowing that, you know what, my children will have food on the table for the next couple of weeks. I'll be able to pay my phone bill. I'll be able to pay my medical bill. Those are all environmental stress factors, and environmental factors cause stress, which can cause other mental health challenge. So I think each of these pieces actually are connected to our mental health. And therefore, we've been able to support our clients in that way and hope to continue to.
Absolutely. And I think I see some notes here that I thought was really interesting, and maybe you could talk about a little more. I know we've talked about this pandemic aggravating pre-existing conditions our clients face, including poverty that they have already been experiencing, or food insecurity and housing insecurity. I mean, that is something we've been helping people with way before this because of other disadvantages and other situational aspects of their lives. So I was wondering if we could talk a little bit about the barriers that clients face in accessing mental health support and resources.
Sure. Well, unfortunately there are many. Language barrier being one big one. The wonderful thing about Ayuda is that almost all of our staff are bilingual, whether it be Spanish, French, or other languages, and we have a great language access program that if we are not able to serve them in the language that a staff member speaks, that we're able to provide interpreters to ensure successful work together. There's also a lot of cultural stigma around mental health, and the myth being, well, therapy is only for crazy people. We all would benefit from therapy, truly. Doesn't matter what your background is, but that is a huge stigma that people have. Also just discrimination, racial discrimination of programs, of societies, of systems. And then I think particular to our client population is the fear of accessing resources. Will this affect my legal, immigration legal case? Could I be picked up by ICE? And I think that fear in particular is very specific to our client population, and I think plays a huge amount of stress on reaching out for assistance.
Right. Like if I want to access a therapist, all I'd have to do is go into my insurance provider's website, pick somebody and give them a call. But if there's already so much of a barrier to not being able to get insurance, or being afraid that seeking support will release your information somewhere it doesn't belong, or not knowing if you can get services in your language, just adds so many layers that it would make somebody, I can imagine, feel really discouraged and just kind of think that they have to just deal with it.
Yeah. Yeah. And not only accessing mental health services, but as Carla was saying, many times our clients are in a room with other people, and so it's very uncomfortable to speak about trauma and to do so in a way that feels safe. While, for many of for others, lucky enough to have a room where they can do this quietly, where they have the time to set aside and just focus on it, is a different type of service, and not one that a good majority of our clients have access to.
Right. It also, it came up in national news as well that the pandemic has caused people to have to be home more often in abusive situations, which is really unfortunate. And because we help a lot of trauma and domestic violence survivors at our organization, is that something that we know is happening with our client population, that they're in an environment where it wouldn't be safe to reach out to Ayuda because of the fear of retaliation by a member of the household?
Yeah, I think with my unique perspective being new, one thing with therapy, I think it's imperative that you have a trusting relationship. The person that is seeking therapy wants to know that the person in front of them is someone trustworthy. They come in already with these preconceived notions. Can I open up to this person? Should I talk about this? The risks. And so with this pandemic, I've seen a lot of challenges because we have a screen in front of us, and trying to build that relationship with someone that they don't know has been a challenge, and it's very personal. They're bringing you into their home, whereas they would typically be going to a therapy office outside of their home. They're able to disclose certain things that they may not share in front of the screen, and aside from maybe being in a home with someone that may want to retaliate for talking about anything, they also have children. A lot of our clients aren't able to dedicate the 45 minutes or hour to therapy to talk about, what they're feeling. They have to make sure their children are okay. All of the kids are home from school. So that has been another challenge as well. But I've also been able to see just, again, the resilience that they still find time to meet with me. They still try, they still want to work towards something. So although it may not be the typical quote unquote therapy session, it's a lot of building that rapport and that relationship and kind of creating structure, because we lost a lot of that. Our routine and our structure throughout all of this really has been thrown out, I think, for everybody. And so instilling that with them, kind of giving them a day where they can dedicate to themselves in therapy, whether it be how do we how can we relax better? If they're having trouble sleeping, we can talk about sleep hygiene. What can we do to kind of alleviate that? Nutrition, exercise, what can we do with our children so that they're not causing so much stress? Making sure they're safe. So there is a lot that can be done, but there is a lot that is hindered because of this.
Yeah, I really appreciate you commenting on that, because I think, Carla, since you've been with us for 3 months, you had started right around the time of the pandemic. And so you've been in a really unique position of starting as a virtual therapist, which is not the way you would have started otherwise. And we're just really grateful that you've been able to develop so much trust and rapport with your clients so far, because I know it's really challenging. So kudos to you for doing that, because I'm sure that's hard.
I've definitely had a very supportive team. And I will, to piggyback too, when I do check in with these clients, it's great. I always want to make sure everything is okay. And they're always talking about how grateful they are to have a certain case manager supporting them in a financial aspect, or even talking to them, because they've had this relationship prior to me coming in. So I think it's just a big team effort. Really, it's been something that I've seen. Just that human connection, even if it is over the screen, is really important.
I had another question, and I don't know if either of you will be able to answer this because we don't have anyone from our legal staff on the call, but being the volunteer and outreach coordinator for Ayuda for a couple of years, I've worked with all of the teams that we have in all of our different programs. And one thing that has really stuck out to me is the level of detail that our attorneys go through to present the best possible case for their client. They are advocating very hard for them. And I'm aware that sometimes clients need help with writing declarations, and they have to talk about all of the terrible things that have happened to them, especially in an asylum case or a trafficking case or a domestic violence case. And I know that that's a necessary part of the filing that they have to do, and it can really help make a compelling case. But what is that like for a client to have to do? Because I know we touched on re-traumatizing. And does social services ever play a role in helping get those declarations from clients? I mean, Andrea, you might be able to speak to this more.
Yeah. Well, first off, the writing of a declaration can be very traumatizing. You are asking someone to not only relive, but to think about it, to write about it, to speak about it, which are all forms of being hit with that information head on, and to be done in a way that's very detailed, which can be very upsetting and, again, triggering for a client. So in terms of the best way, if we're trying to do these in a trauma-informed way, is to have if possible, to have the therapist or have the individual go to therapy beforehand, so they know the coping techniques, they know the grounding techniques, they know the signs of being re-triggered, so that when they do write their declaration, it is done in a way that is safe. Unfortunately, that is not always the case, and just due to timing, lack of understanding. But ideally, a client will have had therapy before getting an evaluation done. We sometimes do help with evaluations. Again, our role as mental health services at Ayuda is not our primary role is to provide therapy to individuals who are interested. And if possible, and if we have the time to do an evaluation, unfortunately right now there is, with the way that our legal cases are going, my understanding is that it is required and necessary more and more to have these evaluations done. And I know that they are quite expensive to have done outside. So there are a lot of challenges as well. But at Ayuda, our mental health services do focus primarily on providing that therapy with the occasional evaluation that is being done. And I've seen it done in both ways, where a client has come to me after they've done their declaration and is still very much triggered. And then I've seen clients who have been able to have 3 to 4 months of therapy and then do their declaration. And it is a much more successful and safe process that way around.
That makes sense. Yeah, thank you for commenting on that. And that leads me to the question of, I think we're going to start wrapping up the conversation relatively soon, just finishing out any more comments that both of you have on the role of therapists at Ayuda, any more notes that you have on that. But a question that came to mind was, how as therapists do you protect yourself from re-traumatizing yourself from something you've been through or taking on vicarious trauma? I know that's really important in the social work field and in the mental health professional services. So I was wondering if either of you could comment on self-care, and I mean self-care beyond just a bubble bath, let's say self-care of how you deal with some of the vicarious trauma, because the level of trauma is, I mean, there's different levels of trauma and everyone has experienced it, but some of what our clients have been through are pretty horrific, and you have to be pretty strong to deal with hearing those things. So how do you deal with that?
So I could speak to my experience with self-care. I think a big part for me is the support that I have, not only at my job, but also at home, whether it's my family or my friends. And so just making sure I give time for myself to be able to just talk about what I'd like with them. So whether it's talking about, I don't know, going for a walk, or, you know, I enjoy doing makeup. So different things that I enjoy for myself, I try and do that. Also, I think a big thing is supervision. As therapists, I think it's really important to use your time in supervision to talk about things that may have been brought up, because although we try and be very self-aware of things that, you know, may trigger us, or things that, you know, really had like a profound effect on us, there are things that we may not have heard before, experienced. So just being able to have that open communication with a therapist and usually our supervisor to process that. So in my position, I think both at work and at home is the biggest way that I take care of myself.
And Laura, I think you mentioned vicarious trauma, which, yes, it is very common for mental health professionals, but it really is common to, I would say, any professional, whether it be on our legal side and our social service side, to experience it. Really what vicarious trauma is the indirect impact of hearing over and over your clients' traumatic stories. And if anything, I almost think with our pandemic, we're more likely to experience vicarious trauma, whether we're professional or we're just watching the news, because it is so repetitive and upsetting. And so I think to counter that, it is important to know what your triggers are. So if you've experienced certain types of trauma, being aware of that, making sure that you are doing healthy coping skills. I would say now is probably not the time to plan a big self-care trip away, or to do any kind of projects that are not part of our normal routine. As Carla was saying, self-care is part of our day-to-day life. So it's things that we are already doing, but I think now more than ever, being aware that we need to implement that. Since we're all sitting at our computers or in the same room all day, every day, making sure you're taking those breaks, making sure you're talking to friends and family, maybe even avoiding certain friends or family who could be adding to that stress, making sure you're having time to watch, you know, your favorite show, or read your favorite book, or listen to relaxing music. All of those things are even more critical now, because some of our self-care is not available to us. Maybe it was playing on a sports team. Maybe it was meeting friends to go see a movie, or any other number of things in group settings, which now we're not able to do.
Right, and I think there's a lot of triggering media right now, so limiting your media intake can be helpful. I know that a lot of us want to stay informed, but to a certain degree, it's important to step back a little bit And I think one of the things that I've taken away from this conversation is just memories of all the stories I've heard over the years of the resiliency of our clients. And it's so nice to hear that they are showing that resiliency more than ever right now, given the multiple factors that are causing them more stress and more trauma and more difficulties. So I'm really um, grateful to you both for continuing to provide these important services. This is needed now more than ever. Um, Andrea, do you have anything else that you'd like to share about the role of a therapist, or any other comments about the work at Ayuda right now, or Carla as well, either one?
I think that it's really wonderful to be part of an organization where we are able to provide and to help others, not only in pre-pandemic times, but especially now when you see the needs. And to know that, again, going back to mental health, it's impacted by all aspects of life, both on our staff side and our client side. We all are, I think, sharing many of the same challenges, and which are very normal, which are very common in this pandemic and this quarantine time. And a lot of times we get asked in therapy, is something wrong with me? Is it bad that I'm having these thoughts or feelings? And the answer is no. You're having a normal response to what you're seeing, what you're experiencing. And the nice thing about therapy is that it is a place to better understand your thoughts, feelings, and your behaviors, and identify the ones that are healthy and helpful, and to identify the ones that maybe are not as helpful as maybe they were at some point. And that's not just for our clients. I think that's something that we all can and should be doing.
Yeah, I agree. I think that normalizing what we're feeling to our clients is also something that has helped with the connection. So telling them that I, need to go for a walk myself, or I need to make sure that I'm, not watching the news every day, like watching it maybe once a week, I limit it. It has brought a connection between us, because they're saying, okay, so it's not just me feeling this way. And in a time that, things are kind of out of our control, I think in therapy, we can give them control. We talk to them a lot about psychoeducation and letting them know, what they're going through is a normal response to abnormal things going on, like Andrea said, and giving them control in therapy. So, as I talk to them, I ask them certain questions, but I remind them, if you don't want to talk about certain things, you don't have to. We can pause here, we can stop when you'd like, we can move on. And so I give them control. And I think that's also really beneficial in a time that they feel very out of control. So normalizing it and giving them some sort of control.
That's awesome. That's really cool to hear. That's just kind of in the mind of a therapist, how you help someone work through trauma and empower them. Lastly, is there anything that our community or anyone watching can do to help Ayuda right now, or help social services? Is there anything that you can recommend for support for your program?
I think if the support can be shown in many ways. We do have our COVID relief fund, which has been monumental in assisting our clients right now. Volunteers also have been really wonderful in helping us provide our client assistance programs, our food bags, our diaper bags to our clients. And that's something that I'm sure that we will continue to need as we go through this. But I also think just being aware and talking about these challenges that our clients face within your own community is important, because as you're saying, a lot of times if you don't know about it unless you're told. And I think it is part of our responsibility to educate those around us on these experiences, because these are member of our communities, essential member of our communities. And I think it's important that the challenges they're experiencing are made aware.
Absolutely. Yeah, I think it's important to, if you can't contribute, to educate yourself on your community's struggles and give back where you can, because this client community makes our DMV community thrive, and they are important. And I think that's a view that we all share at Ayuda and what our work is all about. And just, it's been really great to talk to you both during the tail end of Mental Health Awareness Month. I think this is one of the most important May mental health awareness months ever, probably. And I hope that if anyone watching has any further questions for Andrea or Carla, they will comment when this is posted on Facebook and we can get back to you. Also, I just want to shout out that if anyone is having any feelings of being down, depressed, hopeless, there are resources out there. There are hotlines that you can text, that you can call. There is plenty of support, especially right now. You are not alone in what you're feeling. I think that's one of the main messages
Yes.
of the month. So if there's anything else that you want to say about that before we close out, I just wanted to finish on that note that we wanted to give a discussion of what Ayuda does, but also for anyone listening, make sure your mental health is a top priority if you can right now. That it?
I think so.
Okay, wonderful. So Andrea and Carla, thank you so much for participating in this discussion with me. It was really insightful, and I really loved hearing everything that you both had to say. So thank you so much.
Thank you.